Week 3 with Paul. Here we are, Paul, for week 3 of your training in this facility, would you call it?
Yeah, that'll do.
And what were you saying, Paul? Back in the 70s, what?
The facility I'm in at the moment go back to the 1970s, and I delivered babies here and managed heart attacks. It's slightly changed in the demography of the people that are in this.
Well, there'll be still some heart attacks in here.
Still somewhat?
Still some heart attack victims in here. Victims, targets.
They have it, but it's not a cardiac therapy place.
Not anymore, no. So Paul, this is week 3. Now, Paul, what we're doing here is we're training Paul each week in the facility here, because we've trained for what? I can't remember, 10, 15, something like that. We've trained for over a decade at the gym.
And he doesn't repeat his jokes very often.
No. Okay. Okay, now we can edit some of this out. We haven't actually, this is live, so it's when the live is in, we're recording it live. We're not doing any editing, so there's no magic in the canned laughter. So Paul's been training for quite some time with me and training at least 3 to 5 days a week. At least, can you say that? At least 3 times a week, which has been really good. But today, Paul texted earlier and said he has a sore knee. And I'm not sure if he was trying to make an excuse to get out of it. I'm sure you weren't. But at the same time, it's a good opportunity to work with you with a sore knee, because most people at your age in life are going to have sore knees.
Well, I suspect...
Or present with a sore knee.
I suspect I know what caused it, because it feels quite internal in the knee. So it's most likely inflammation. So at some stage I'll get off my bum and go and see a rheumatologist and get it injected. Possibly.
It's a Paul, being a doctor, resorts straight away to the chemical, I won't call it intrusion, what would the words be? The doctoring, the medicine.
Insult.
No, but you went straight to I'll go see someone and get something done to it.
Well, it feels like it's internal in the knee.
Yep.
But not ligamentous, so it feels like something, scratching of the undersurface of the kneecap, that sort of thing.
Which is possibly right, but my lane is movement. And so if you go default back to where you were sitting before, I'll see if we can get the camera shot of it. If all this morning, Paul, how were you sitting just 5 seconds ago? Where you were sitting, Paul wasn't sitting like that before. You were sitting...
Oh, like that?
No, other leg. So you can imagine... I'll try to get the shot of both of you. That means both your head and knee. You imagine sitting like that for multiple hours of a day.
Which is what I've been doing.
What you've been doing. I walked in, you were sitting like that, and then we got up from this chair over here and moved all the way over to here, which is a big distance for a guy Paul's age.
You're so kind.
But no, it's great you went that whole 2 yards, but those knees, that's going to get tight. It's going to get tight for a 20-year-old. It's going to get tight for tight for a 30-year-old, and specifically a tight for you, Paul. And you're not moving much now. So if you can get in the habit of not crossing your legs and shortening the groin muscles, which possibly are causing tightness down here, which is possibly leading to a tightness here. So every time you move that hinge joint, this is the hinge joint of a door. If you can imagine that. So if I go flash to this door here, this hinge there, if you put heaps of weight on that handle, that hinge is going to have a lot of more effort to move. And that's what's possibly happening to yourself, Paul. Not denying what you first said. What you first said about, you probably got it's something inside the knee. It probably is something inside the knee.
Well,
it might not be.
My exercise has declined a bit since I last saw you because of that. But just for the last few days, the corridor outside this room is about 60, 70 metres or something. So I'm just making a point of doing that number of times a day, so it just gets some...
Yes, you just got
some movement.
And what you just said is right. We've just trying to get some movement in the body, which is now not moving. You went from working, getting up and down your chair every time you saw a patient. They came in. I'm sure you stood up as they came in. You would have been going to get stuff from different parts of the office. You would have standing and sitting a lot of times during the day. Did you walk to work?
No, I didn't. But being a general practitioner is basically sedentary. Yes, you do pop up and down to get patients. I always used to go to the waiting room to get my patients.
Okay, well that's even better.
So that's 5 metres, 10 metres of exercise.
But you weren't sitting like now.
I wasn't sitting like
then you, but you were doing that, and you were training because you were training with a trainer before you came to me in Brighton, and then you trained with us. You've been training for like the last 20 years or so, probably more than most people. But now, you've probably sat more than most people.
One thing that helps this, sometimes it's a good thing to have cancer. Because I lost a lot of weight and I haven't put it back on, even though the cancer is now cured. So I have lost a lot of weight.
Yes.
I'm trying to get as much incidental exercise as my lazy gene will allow me to do.
Yes. And the lazy gene as a human being is just normal. People love to sit. You go down to the beach now, everyone's sitting down. That's what we do as a human being. There's nothing wrong with that. The trouble is sitting in that position. Because we used to sit like this, like on the rocks, and as a beast. You look at tigers; they're not sitting in that position. Tigers are lounging. We used to sit. Apes are sitting sort of around. We're as a beast, we've sort of adopted this sitting position, so we tighten the hamstrings. In Paul, you can't see that in the camera. I hope to get a bit of. What's happened here? It says low battery. We've got a low battery, so we might shut out halfway through this session. So what I was saying is, Paul in that sitting position, you sort of can't get that. I'll zoom out a bit, Paul. Here we go. In this sitting position, you've got Paul's getting tight hamstrings here, underneath here, and of course tight through the psoas and hip flexors. And that's what you guys do when you work in an office all day. So you're starting to get tight and then potentially getting a sore knee from that, or it's a sore knee because of the age it is, but you're sore in that knee, aren't you?
Yes.
But that knee's the same age as that one.
Boy, he's smart.
So a question, why is that knee sorer than this knee? He might have knocked that when he was 20 or 30.
I vaguely recall that I was kneeling to get something and slipped and got a crunch on
Okay, well, I was going to say, or you've hit that knee somewhere in your age when you were 30 or 50 or maybe recently.
And of course, I really haven't been taking much care of it since.
Yeah. Okay, so what we're going to do is still do the exercises we want Paul to do, because although I'm not ignoring the fact that Paul's injured, like I'm not ignoring the fact that you might be injured as well, but we also got to be conscious of the fact that you have to get down onto the toilet seat and get off the toilet seat. You have to get up off the bed, and then the first movement's the one that's going to hurt the most. So the stronger we can make you, it's going to be better.
I'm looking for something to show you. It should be hanging up somewhere.
I'm trying to be sarcastic here.
When you're saying all the exercise I should be getting.
Here we go. Paul's reaching for his magic bed posture position. It pushes him out of bed, which is great. Okay, that is good up to a point.
Yes, I know.
But that gets you up off the bed in that position which I'm in now, for example, and you obviously twist your legs off to the side.
Next question, how do I get it down? This one.
But that twists your legs into that position you're in right now. So it gets you up, and then you're in this position. Yeah. But now how are you going to get up? So you're going to have to use it. So where's the magic button for that? So the magic button is going to come from Paul doing the exercises, even with a sore knee. So Paul, if you could just, sit forward, put your feet back. So we've got a low battery here, so we'll get through the exercises, Paul, and then we'll do the post-amble rather than the preamble.
I tried this earlier today and just sort of collapsed backwards.
Okay,
Not quite sure why.
Just do your best, Paul. Yep, that's good.
Oh, it's partly the knee playing up, but also it's just because I haven't done it for a while. Okay,
so what we'll do, if you've got a friend or if you've got someone with you, hopefully you've got a visitor, hold that, Paul, both hands. I'm going to just hold on to that. You just lean forward and pull yourself up on that.
Oh.
So you can have someone hopefully help you do that. Now slowly down. So it's really important to do the slow part down, because that's where the muscles are really going to get strong. Paul just shuffled his feet close together. I want you to put them apart, Paul. Now put your feet apart. Is that nice? Stand up.
Yep.
Yeah, and then go again. Now as you go down, breathe in. And whenever you want to stop, you can stop. If you want to do another one, you can do another one. So you're not going to have someone in front of you doing this. So you need something to hold on to. So what I suggest, a door frame's really good. How are you feeling?
Hurting the knee.
Hurting the knee, stop. Okay. So what we do, it just started to hurt Paul's knee now. So zoom in there. It just started to hurt Paul's knee. So train up to the point of fatigue, not pain. So you don't want to train through pain. You know that classic old quote, no pain, no gain? Well, they really should change that to no train, no gain.
Have I told you about the gym instructor at school? He was an ancient Austrian who was in the he was certainly in the Olympic Games. And his mantra was always no gain, no pain. So I'd look at him and say, no, my mantra is no pain, no pain.
No pain, yeah. So no pain. Yeah, which is true. You want to not have pain. You don't want to... When you're young and you're training, you just sort of bite through it and stuff. But we're not here to set records on, get PBs now. We're going for Paul's best, a PB.
Oh,
but you do the best you can do. And there's a great quote by R.M. I used to quote it as R.M. Williams for so long, this quote by this book I read years ago. All you can do is all you can do, and all you can do is enough. So all you can do is all you can do, and all you can do is enough. Now I got the title right because I love the title. I've quoted this guy for years. And then I recently recommended the book to someone, and it's not by R.M. Williams. So I apologise to the author.
If I don't have anyone else here, is it okay to wedge a chair?
Yeah, well, I was going to say, you could possibly use a chair, but Paul's got you possibly all have one of these. You possibly all have one of these. If you can put that in front of you.
Listen, I've seen people who go to your gym and not all of them use...
I've put the brakes on that, so you might have one of those. See if that works, Paul, if that helps. Get it in the right position. I've locked it. And see if that helps, because the hard thing is getting it right. You can't notice, but Paul's shuffling his feet to get in the right spot. No. So lean forward as much as you can, Paul.
Sorry?
Lean forward as much as you can. Go for it.
I'm not quite sure. I fall back.
That's okay.
Yeah.
That's okay. So falling back's okay, but try to fall back slowly.
Yeah.
So even if you come up a little bit.
That the exercise, the squats.
Pardon?
The exercise, the squats.
Mm.
If I do, that's a similar movement. If I hold on to something while I do the squats, is that equivalent?
Equivalent, absolutely. So if you can do that now, but coming out of the chair doing it, because you're going to have to come out of the chair to do your squats, aren't you?
Yeah.
There we go, nice. So Paul took it's almost trying to find the S spot, the squat spot, or the sitting spot, or standing spot. That's it, yep, you'll find it. Yep, it hurts your knee too much, so let's just rest. So it's awkward to have a sore knee. It's nothing worse than having a sore knee, because it's going to make you, whatever you've got to the stage where you're training, at any age, when you're an athlete, 15 years old, sore knee, stops you training, so you detrain. So sadly, it's like that. But what I'm going to try to do, if you can get someone to help you do this, I think it'll help a lot. Because Paul, everything's tight here. So I'm going to, with Paul's permission, I'm going to stretch his leg and it'll get you to watch us.
Do you want to switch the volume down before we do that?
No. So we're going to get in a position, Paul, but I just want to make sure we're going to be in focus into the camera. So I'm going to get you to stand up with my help. I'm going to get you to put your hand against that wall here, and hopefully you can see what we do. So with Paul's permission, how come he can stand up like that?
Yeah, because
you can use the arms of the chair, perfect. So I'm going to get you to lean against this, Paul, and get yourself balanced. So this is either going to go really wrong or really good. We're going to stretch the leg which is sore, which is the left leg. So Paul, go closer to the wall and hold on to that handle there. So hopefully we've got you in shot here. So what I'm going to be doing is stretching Paul's left leg by getting him to bend it behind him, and I'm going to hold it. So you get someone to gently hold this leg, and as I hold it, I'm going to encourage Paul to bring his knee back towards me. I haven't pulled up, okay? And I'm getting him to push his hip forward. Can you feel that?
I can feel it in the quads.
In the quad. Paul's using a technical word, quad. Everything is one syllable in the gym. Do you know that, Paul?
Sorry?
Everything is one syllable in the gym. That's actually, what's the real name for that muscle?
Thigh?
No, thigh. Okay, what else is it called? Technical name.
Quads.
That's not called quad.
Quadriceps.
Quadricep, something else. Femoris?
Yes, femoris.
I think it was that bicep femoris. Anyway, it's called the quadriceps, the muscle and the hip flexors. But in the gym, as most trainers will tell you, everything's one syllable. So you got your quads, your ceps, your pecs. So push forward at the hip, Paul. Just really push forward.
Oh, yes.
So I'm not supplying any pressure here. I'm just pushing there to let Paul know to push forward at the hip. Keep pushing forward.
Well, that stretching of the quads is...
Now, the trick with the person helping you is to release it slowly, because sometimes the releasing it really hurts. It sort of jams in. Whilst we're up, we're going to do both sides, Paul, so stay there. I'm hoping it gets... So hold on. No, don't turn around, because there's no wall behind you to turn around to. Let's go again, Paul. So bend the right leg now. So I'm just holding it there to let Paul get into position, and Paul's going to push his hip forward. Just push the hip forward gently, Paul. And you notice how as this gets tight here, Paul's head drops down. So Paul, keep your head up and push the hip forward as much as you can. So I'm not pulling up and I'm not pushing forward. I'm just having my hands there as a cue point for Paul to push the hip forward. You might find the knee goes out to the side, so try to keep the knee in. So everything's in line and just push the hip forward, Paul. We're going to do both of them because both of them will be as tight as each other, but one will be tighter than the other. That made no sense at all. Both will be as tight as each other, but one will be tighter than the other. Do you like that, Paul?
Yep.
It made no English, and carefully release. We held that for longer than you probably think you should. How's that feel, Paul?
That's good, yeah.
Okay, so go back and have a seat, carefully.
But you're quite right in the sense that since I've been here, apart from the exercise I do get, if there's no incidental exercise,
Yeah.
I've got to think about it, of going for a walk or doing something.
Yeah, and you're, with all respect, you're a doctor. You're a plumber, you're a carpenter, you're a waitress, you're an accountant. Whatever you are, you weren't an athlete. I've lived in the gym all my life. I'm a phys ed teacher. I've enjoyed training, whereas most of the other ones I just listed don't. So why would you then suddenly come here and go, now I become an exercise freak?
Well, I come here, it's a new environment with new people.
Yeah.
So yes, I've obviously met them and socialised, but it's not the same as having continuing socialisation.
Yes, but correct. But what I'm trying to say is, you didn't suddenly arrive here as a 75, 80-year-old and become an exercise freak.
No.
I train guys who've had strokes and they're told to exercise 4 times a day and they're having trouble. I go, but you used to run a company, a CEO of a company. You weren't into exercise anyway. So why should you have? It should be challenging to exercise every day because you're not used to exercising every day. A normal person, you were doing a lot of training as a person, but not many people are doing that. That's my point. So just because a physio says to you as an inmate in an establishment like this, you've got to do your exercises, you weren't exercising before, usually.
Well, I'm about to be transferred to another place, and I'll see if they have visiting physios and send
Yeah, they will.
give me good sessions. Yeah.
Great. So sit back in that chair, Paul. Like shuffle right back in that chair, in like it's in straight. Straighten up your legs, like they were before. Feet slightly wider. Feet slightly wider. And let's see. Put your hands in that chair, Paul, and let's see if you can do a squat now.
Oop.
It's okay. So come forward. Put your feet back. So that way we're tipping over the centre of gravity. Okay, feet, yep, that's good. Nice and low down, that's good. Was that knee or muscle?
Knee.
Hurt the knee then?
Yeah.
Okay, then don't do it. Okay, so we tried to alleviate Paul's, if you like, situation with a stretch, but if it's still sore, don't train through it.
Well, of course, it's It's probably something to do with the undersurface of the kneecap. And once you start doing that, it's rubbing it.
Yeah, there's no doubt. I'm just trying to help by relieving some stretch here. And the other stretch you could do if you've got a friend with you.
If I do it like that,
Yep.
there's very little pain. So it's not weight bearing.
Okay. Well, we're not sure. The more we know, the more we don't know, Paul. And I definitely don't know.
I could do the classic, shouldn't I go off and have an X-ray?
Should. Why not?
Yeah, I'll wait till I've moved to the other place and get it done there.
Okay, so another stretch Paul could do is if you've got someone helping you, great. If you haven't, that's okay. You put your legs straight out, and in this position now, I'm going to get Paul just to lean forward. So just trying to stretch the back of his knee now.
Yeah. The hammies.
Now, if Paul does that and leans forward, gets his stick here and pulls his toe back to him. And pull that back. Yeah.
Oh.
How's that feel?
I now know what most league footballers feel like when they tighten their hammies.
So you can feel that. Paul saying the hammies again, or he used 2 syllables then. So hammies, hamstring in the back of the leg, the calf. Do you know why it's called a hamstring?
The Romans cut it to stop their slaves running away.
No. So we just stretched the back of Paul's legs, which is hamstrings, and we've got the calf down here. And we'll do the other side, Paul. So back, you know the 2 tendons behind the knee here? Mm-hmm. The 2 tendons, if you fast forward or rewind back to when you were a kid, or see kids, how old's Edward?
He's 12.
So Edward's 12, so when Edward was running around in his shorts when he was, say, 6 or 7, remember the 2 little tendons in the back of the leg you used to see? So the butcher would get the leg of pork and cut the leg of pork off and get the 2 tendons and tie them together and hang up the ham by the strings. So those 2 tendons were referred to as the hamstrings. Pull forward.
You learn something new every day.
Pull forward. Yeah.
Oh,
You feel that stretch?
Yeah.
So we've just got Paul. I don't know if you can see that in camera. I hope you can. And if you haven't got someone in front of you, you could possibly do that with a straight leg, just like that, Paul. Can you still get the same stretch like that? Can you try that yourself?
I think if you stand up and lean forward with a straight leg. No,
yeah, but I'm concerned if you do that, Paul, your balance.
Yeah.
Did you notice how every time I ask Paul to stand up, or he goes and you stand up, he can just stand up. But when you think it's an exercise, you go to, I can't do it. It's interesting.
It's called survival.
That's interesting. So if you just put your leg forward just where you are, Paul, as straight as you can, one leg forward as straight as you can, and now using your walking stick, or your stick, he's going to grab it around his foot there and then leans forward. Now lean forward, Paul.
Oop.
Oh, he broke the stick. Do you have one which hasn't? Are they all the same, are they?
No, you haven't.
Yeah, they're not used to being pulled apart. It's more being
Oh, they are. They're made to be pulled apart.
No, but they're not used to being pulled apart, are they? No. So other end, Paul, if you can, just gently, and you're just pulling forward, and you'll see Paul can get a nice hamstring stretch there. Paul, can you do the other side? Because it'll be better for the camera. And just lean forward, just gently, as much as you can. Yeah, nice. Don't let it slip off.
Hamstring and glutes.
Yeah, bit of glute, bit of lower back. Yeah, it's good. Just sitting up, Paul. So we haven't really done much activity today, Paul, but I think that's enough because we don't want to hurt that knee any more than we have to.
So, but you'd like me to do those stretching things?
Pardon?
You want me to do those stretching?
If you can do those stretching things, that'd be great. If you haven't got one of these, another suggestion could be, if I was to cross over and go into your bathroom here, Paul, just to show people that if they haven't got, or even better, can I go into your cupboard, Paul?
Right.
I wonder if you've got...
Oh yeah, the girl's gone.
Just take this off. I bet you would have one of these at anyone's age. They would have one of these in their cupboard. The dressing gown cord.
And put it around the foot.
Put it around the foot.
And pull.
And pull forward. So I'll get that on camera too. So I just raided Paul's cupboard and got his dressing gown cord, and you could use a bath towel if you want to, or you could possibly use, what else could you use, Paul? Well, you're as much use as me.
No, that's also doing the calves.
Yeah, so it's doing the calf, which is the calf when it's tight pulls on the back of the knee, the hamstrings pulling on the back of the knee, we stretch the quad. So it's a bit of a stretching workout, which is just as important as the muscle workouts, just to keep, it'll make you feel really nice. Do you know there's no evidence that stretching works?
No?
Yeah, there's anecdotal, and is it anecdotal, is that how you say that word? Anecdotal. People say they feel better, but there's no actual evidence. There's lots of studies done on it, but there's not enough to say this will make you feel better. Sorry, this will make you better. But anyway, I think it's an important part of the program, stretching, especially when they're tight.
Yeah, and a lot of people do it with the neck as well.
Yeah, well, yeah. The more movement, the more mobility you can get, Paul, the better it's going to be for you. With everything. Yeah, so it's important to keep moving at any age, but specifically for Paul. So Paul, we're meeting each week. Paul and I have been discussing this for ages about getting together. We're meeting every week now. What do you want to call this place? I keep calling it establishments. What would you call it?
Respite care.
Respite care.
Respite care.
Yeah, but that's okay. This is okay. What would you call the demographic of people who are going to watch these videos? Where are they?
Some of them will be in my age group.
Yes. Not
Not necessarily as old. But you'll have a lot of young people coming as well who need the instruction in stretching and...
Yep. I'm also concerned, Paul, you're starting to do this.
Yes.
Have you noticed?
Yes.
Okay, so with your permission, because the battery's going to run out soon, with your permission, I'm going to get Paul to do an exercise. So I'm going to ask him to stand up again.
I sometimes told ladies who were getting the dowager's hump to get a broomstick, put it down the back of their bra and wind it.
Wind the bra, yeah, which is pretty much what we've just said, which is what I'm going to encourage you to do. So Paul, if you could stand up, and you'll notice how Paul will naturally just stand up, whereas before he was struggling to stand up when he did his exercises, which is quite interesting in and of itself. Paul, come across to this door here, or a flat surface you might have in your apartment. Go to that door, Paul. Put your back against the door. And we're going to put Paul's heels against the door, and his back against the door, and everything's against the door now, so including his head.
Yeah.
He's got his head back against the door, and that's the posture. Now, Paul, can you put your elbows up beside your shoulders as much as you can? And now bend the elbows so the hands go up. Now, Paul's got a shoulder injury.
It's tipping me forward.
It tipped Paul forward, so he put his feet away from the wall, which you don't want. So, Paul, put your feet back again, as hard as that's going to be. So, pull your shoulders back, and now pull your head back so you're touching the wall. Now, as you put your head back, you put your head up, pull your chin in. Pull your chin in as much as you can.
Ooh.
So, okay, have a rest. Okay, so in a second, Paul, I'm going to get you to do it again, and then don't release it until I ask you to. So go again. So we'll start with the heels against the wall, looking straight forward, shoulders back against the wall, head against the wall, chin in, and now take a step forward, but take the wall with you. Take a step forward, but take the wall with you.
The owners would object.
Chin in, take the wall with you now as you walk away. Yeah, now go sit down with in that exact position. Go back to the chair first and sit right in that chair.
And sit upright.
And sit upright with that wall behind you. Now imagine that wall is right behind you. You've got your chest up, shoulders back, chin's in. And that's the posture. Look at that. But if we could cut back, that's better. Look at that. Just stay there. You look like you're so relaxed, Paul. So when I walked in, Paul was on his computer over there sending emails. and he was like this. And it's not just your age; it's 14-year-old kids. Actually, 14-year-old kids are like that, which is even worse. So yeah, as much as you can. I'm hoping I was like that when I sitting there next to you. But as much as you can, you want to maintain that posture, Paul, because we really want to have
shoulders back and head up.
Yeah, when chin in, keeping your chin in, as much as you can, because you're defaulting to this. That's a separate issue from the knee, but the knee issue. So we're about to run out of battery, Paul. But before we go, even though you were injured today, and you might be injured wherever you are in your respite care or wherever you are, keep moving, do the stretches, do anything you can, practice your posture. Everything's as important as everything else. Sending your emails, reading your computer, they're all important. Writing your memoirs, it's good. So now we've come to the part of the program where if you stuck around till now, you get to hear about what Paul's life's been doing this week. What you've been doing this week. This is the part of the program we just sort of chat.
We went to see the film Nuremberg, which you shouldn't miss. It's brilliant acting, a brilliant script, and it's a ripping yarn. I mean, I shouldn't say ripping yarn, but it's very, very well done.
What's that about?
And if the Nuremberg trials after the war.
I'm a young guy. Tell me more about it.
World War II, when they got the senior
I do know, by the way.
Nazis, they put them on trial for war crimes. And what's his name?
Brad Pitt?
No, the Goering. Goering was Goebbels committed suicide before they arrested him, but Goering was their prime defendant, and there were 12, I think, or more, but he was the one they were going for, and they got him. And there was an American psychiatrist whose job was to say, is he fit to stand trial, sort of thing. And the mental tug between the two of them is just incredible to watch, and it's brilliant acting.
Is that, you said you saw it now?
Yeah, it's just started the last few days. The film with Russell Crowe.
Okay.
Russell Crowe played Goering.
Okay.
And he's either put on a lot of weight or they stuffed him, but Goering was a big man. And just the tussle, the mental tussle between the two.
Yeah, great.
It's a great film. Strongly recommend it.
Okay. That's this week's Words of Wisdom by Paul.
Mind you, there's some pretty dark stuff in it as well. Films of concentration camps, only brief clips, but not very nice.
No.
Yeah, I'm not sure that they were necessary, but they wanted to gain more.
Well, it paints the picture, I suppose. Yeah. A bit like what we try to do, paint the picture of pain in here, Paul.
But the other thing we did last week was go to the musical Anastasia, about the so-called missing daughter of the Tsar for World War One. Just after World War One. And it's a great show. I don't know how it happened. We happened to go on the second night it was going. It wasn't even the opening night.
God, so you've come into this space and you've gone out more than...
Yeah.
So it's good.
Slight difference in show between Nuremberg and Anastasia, but they're both worth seeing. Yeah,
that's good. We should have a film review by you every week. Films by Paul, or books by Paul.
Yeah, I'm not going out nearly as much now as I did. I'll get back to it, doing operas and concerts and we're fiends at that sort of stuff.
Yeah, and I recall you having trouble doing that because of the stairs. Yeah. You were saying the steps at certain centres or stadiums.
Well, the Anastasia's at the Regent.
Yeah.
And they do have a lift, but you have to go round through and go up via the restaurant next door. But the stairs are it, basically, and they're difficult to climb.
Yeah, and that would happen at, what's that one in the city? The centre, the performance centre. What's the one with the big spiral? What's that one called?
Oh, yeah, the art centre.
Yeah, you'd have trouble there, wouldn't you, with the stairs there or not?
No, because they do have good escalators and lifts.
Okay. And if you have to get up and go anywhere special during the show, what happens then? When it's dark, do you have trouble finding...
I did my best not to wet my pants.
Yeah. Do you have trouble getting out, like when it's dark? How do you...
No, because you've got
navigate yourself through that?
You've got the back of the seat in front of you just to...
No, not getting up, but like navigating your way through a show when it's dark. Are you having trouble with that yet or not? It's okay.
That's awkward.
Yeah.
It's awkward.
Yeah. Do you take someone with you?
Oh, well, Sue's usually with me.
Great. Yeah, because that's the sort of stuff. So the activities of daily living now, the ADLs, remember the old acronym, activities of daily living, for you have changed. Your activities of daily. So if you can continue to, because the more you can continue to get out and see the shows and stuff, it keeps your brain active, keeps you going, something to look forward to. It just all that lively stuff.
Well, there's two things that inhibit. One is muscle power, and the other is bladder capacity.
Yeah. Yes, but I'm just questioning that or raising this because Paul's writing his memoirs at the moment, and he's changing the title to "The Best Is Yet to Come."
And the tag was I've already forgotten it.
It's written somewhere. I can go get it. It's actually on my phone. I can't get it. So the phone is being used to record. Something else.
The Best Yet to Come. First of all, it's a great song by Frank Sinatra. But to take that attitude in life that I don't care really what terrible things happen to me, I just got to keep telling myself that the best is yet to come.
Yeah. Yes, and that's hard, but at the same time, it's great to hear you're still seeing movies and stuff. And we've got to keep you moving. Yes. If we can keep you moving, so you can keep doing those things.
The tag that I changed this morning is the title of my memoir won't just be "The Best Is Yet to Come," but I've just lost it again.
I've been told if you touch behind the left ear, it jogs the memory. So if you give it a go and see if it works. If it doesn't work, it's because my memory's not good enough. I think it might have been the right ear. No? I can't remember which ear it is. Boom, boom.
That's the other. I'm quite happy to announce that I've got a terrible family history of Alzheimer's disease. And in the last year or so, there's been, where'd I put my keys? What was the name of that? What did I just say? So I would expect that I'm on a downward slide. But I'm 81. What can I expect?
Well, Paul said he's got a terrible family history of Alzheimer's. I've got a terrible family history. But my point with what I was trying to say, Paul, is we've got to keep you moving.
Yes.
Because the more you can move, the more you can do these movies, the more you can get up and have dinner down there. You can go, just more life. So the best is yet to come. So you can still do stuff. Because this, I don't know if you know my mum's situation, but she was not here, but she was in the hospital bed with a hip replacement, and it went sadly wrong. So she had no hip. So she laid in bed for about 25 years of her life, the last 25 years. But her brain was still active. So what's better, the mind or the brain? So if you can keep both going, that's ideally. So the more we can keep you moving, then the more you can do. And so there's a good book at the moment, Paul. When I say at the moment, it came out probably about 5 years ago, and it talks about the brain. Did it start to? Oh, we've got a knock on the door. Hello.
Hi.
How are you? Lunchtime. Thank you. We'll finish up soon because it's lunchtime for you, Paul. It says when we came down off the tree as an ape, because we started to move, we had to remember where we went to come back. So our brain started developing because we moved. So the more you move, the more your brain starts to develop. And then it's a long bow, but it's saying that movement is very powerful for your cognitive development. That's the theory of this book.
If you don't move, you don't have the ability to develop a memory of where you've been.
Yeah, all of that. So we've obviously fast forward millions of years. We've evolved from that. But if we can keep you moving, because I said right at the beginning of this show, you went straight for the medical thing. I went to my medical medicine, which is movement. So we can combine them both. If Paul goes and gets that knee checked out with an X-ray, or you said you were going to see some doctor. Yeah. But if we keep you moving so you can become active, and the more active you are, the more, in the title of your own book,
yes, sir.
The best is yet to come. That's the point of the whole show we're doing here, and hopefully you're watching this and enjoying this. And feel free to comment. Do you know we've had 17 views? we've nearly got two
videos,
two tens in our people watching over. So someone out there, unless your family's watching it 10 times,
I doubt it.
I doubt it. So we've got 17 people out there in the world watching
I think
our show so far.
If I suggested to my grandson he might like to see it, he said, "What for?"
There you go. So, but someone out there is watching it, but feel free to comment and suggest things we can talk to and get Paul to move. And any comments you have or any questions you've got for Paul. Paul's a doctor. He's been a doctor for years. Great medical knowledge in his head, and I'm a guy with a camera. Cool. See you next week, guys. Thanks, Paul.
Thanks, Chad.